Welcome to Luca and Miguel. Enjoy the video.
You start by stabilizing the joint and reducing inflammation. If pain is severe or you see deformity, seek urgent care. Otherwise, support the arm in a sling or folded towel to limit motion and prevent further injury. Apply ice for 15 to 20 minutes every 2 to 3 hours during the first 48 hours to reduce swelling. Once done, gently begin pain-free elbow and wrist movement to maintain circulation while avoiding any shoulder motion that provokes sharp pain. Next, you restore controlled mobility and build strength. Start with passive range of motion exercises, then active assisted movements using your other hand or a pulley to avoid loading fragile tissues. After 2 weeks or when pain allows, add isometric holds, then progress to light resistance work, 1 to 3 kilograms, to rebuild rotator cuff and scapular stabilizers. Make slow increases, focus on pain-free technique, and incorporate scapular retraction and external rotation to correct mechanics. If symptoms worsen, stop and reassess technique and load. Finish by returning to full function while preventing recurrence. Gradually reintroduce sport.
Thanks for watching and please subscribe. It's the best investment you'll ever make.